Hi guys, so I'm going to talk about the diagnosis and also the surgical treatment of the gallbladder disease, and then at the end I'm going to touch on recovery after the surgery for my patients. Now, we talked about the different type of disease of the gallbladder and their presentation in the first part of my short videos. We talked about having the stones in the gallbladder that create the gallbladder disease, which almost 90% of people with the gallbladder disease have that problem, and also the other 10% of the patients that they have no gallstones but the biliary dyskinesia, which is an abnormal function of the gallbladder. Now, how do we diagnose the gallbladder problem? If my patient comes in and they have symptoms of abdominal pain, bloating, indigestion, reflux, 1, 2, or any of those, especially if it comes as an episodic pattern, then the first test that I'm going to do is an ultrasound. An ultrasound of the abdomen will determine whether my patient has a stone in the gallbladder or not. So, first is the ultrasound. And if the patient has a stone in the gallbladder with those symptoms, then they need surgery. There's no other test needed for these type of people. But let's assume that the patient does not have any stone in the ultrasound, and the symptoms are very typical. Episodic symptoms that we talked about are very typical for gallbladder. Then I would proceed with another test. It's called Hernia scan, which with ejection fraction of the gallbladder. What that means is that a patient goes into the radiology suite and they give the patient a medication through their IV, which is a radionuclide medicine, and that goes into their circulation and absorb with the liver, which basically shine up the liver under the X-ray, and it excrete into that main tube and then also shine up the gallbladder. Now, after probably around 20 minutes or 30 minutes, when the gallbladder is shown in that Hernia scan, then the radiologist give the patient a hormone called CCK, which is exactly the hormone that you and I produce for contraction of the gallbladder, and that contract the gallbladder, and then the device, the scan, will scan and measure the amount of radionuclide inside the gallbladder, and what that does eventually, after a computer measurement, it check the contractility of the gallbladder, or in other words, how gallbladder functions and how it contracts and empty itself in response to the CCK and that hormone. So that measurement comes out with a number is a percentage. And that number, usually if it's less than 35%, which we call ejection fraction of the gallbladder, that's abnormal. If it's less than 35%. And what we assume that the gallbladder is not functioning appropriately, and that's called biliary dyskinesia. So those people that they have typical symptoms of gallbladder and have ejection fraction of less than 35%, then they also require surgery. Now, let's talk about the type of operation. The gallbladder surgery, history of gallbladder surgery goes back almost more than 100 years ago. And up to 1985, the gallbladder operation was done through a big incision below the rib cage. Is called open operation. And since 1985, minimally invasive surgery started in Europe, and then after a few years came to United States. And since then, almost more than 95% of the gallbladder in United States is done with this technique. Is called minimally invasive surgery. Now, what the concept is that we make 4 holes in the abdominal wall and place the telescope inside the abdomen, which is connected to the monitor and TV, and then as a surgeon we put a special instruments into those little holes and then operate, in other words, with the chopsticks or the instruments, and then remove the gallbladder right in this area. So we eliminate the gallbladder from this system, but as you can see, the anatomy, the rest of the anatomy is completely normal. You're still able to produce the bile from the liver, which is excreted through this tube, the main tube, which is called common bile duct, into the small intestine. And you're still going to be able to absorb the regular food, you know, fatty food and regular diets without any limitation after the surgery. Now, recently, over the last probably 10 years or so, there's another technology is in the market called a robotic platform. And with the robot, we be able to perform the minimally invasive surgery similar to the laparoscopic operation. We make 4 holes, we place the instruments, but the difference with the robotic surgery is that, number one, the visualization of the robot is much better than the laparoscopic operation. And the other thing that the instrumentations are very different with the instrumentations of the laparoscopic surgery. In other words, with the robotic surgery, the instrumentations are wristed, so it allows the surgeon to perform the operation a little bit better, a little bit more precise, and dissection is a little bit more precise. And overall, especially for very complex operation, is a little bit higher and more advantageous than laparoscopic surgery. Now, we also perform this operation through a single incision, and the robotic platform allows us to use that one incision in the umbilicus in order to perform this operation instead of making multiple holes in the abdomen. So the advantage of that compared to the laparoscopic surgery is most probably less scar tissues and probably even less pain. As far as the recovery, essentially they're very similar, and we're going to touch on recovery pretty soon. Now, this operation is done as an outpatient, and people get this surgery and they go home, and usually takes around 30 minutes to 1 hour to perform the operation, obviously depending on whether the patient has simple gallbladder disease or complicated gallbladder disease like severe infection, so then that actually increased the possibility of the time of the surgery. But overall, more than 95% of the time, this operation is done as an outpatient, so you get the surgery, you go home. And those incisions that are on the abdomen, they're very tiny, but they still hurt. So people feel discomfort and pain. Majority of my patients, they have this discomfort the first few days, and then the pain goes down significantly after day number 3, and majority of patients do not require pain medication after day number 3. They still sore when they move and they do activities, but they are not requiring any narcotics. Now, as far as the activity, my patient's able to walk and do regular activity, going upstairs, downstairs, riding in the car, showering and eating, all regular after the surgery. The only limitation they have is heavy activity and heavy exercise, and we usually recommend 2 weeks off heavy exercise before they can resume the normal physical activity. Now, as far as the complication of this operation is a very minimal complications. Obviously, every time we do any kind of procedures, there are potential problems like bleeding, infection, complication of anesthesia, or damage to the internal organ. But the rests are very, very rare to happen. It's a straightforward operation. Is a very common surgery, and in the United States, probably average around 750,000 people get this operation every year. Thank you. I hope this short video was helpful for my patient and other people that are interested. But obviously, if you need more information, please visit my website at surgicaloasis.com, or you can even contact my office 949-646-8444 for surgical consultation. Thank you.